And then we got, dogs just around the corner there.
Okay.
So I was reading up on the form, did a previous board and train for reactivity. He came back, you feel like he was more aggressive.
Yeah.
Now you're working with Tucker Pups doing positive reinforcement, but still dealing with some reactivity, is that correct?
Yeah, it's just when he gets so agitated, he doesn't care about the food.
Sure.
And that's all he's focused on, basically.
Do you see this in class at Tucker Pups?
Do I say this?
I see this, like the reactivity or the
No, it's really just elevators when we're leaving, when we're getting back, walking in the hallways, the tight spaces. When he sees people, he's like, and with other dogs too. Off the leash, kids too. Yeah, kids he's reactive to on walks also. Okay. Off the leash, he's always been good. Like with any dogs that are friends of ours, he's not aggressive, but in public spaces, he's really reactive.
Okay, so I'm gonna guess that the hardest is like those tight spaces. And once you get out into like the sidewalk or the street, is it any less intense or?
Yes, it's a lot less intense.
Okay.
A lot less intense.
Okay.
He still has episodes where he's lunging, but not nearly as aggressive as when we're leaving our building and getting back to the building.
Okay.
To our condominium building.
I got you. When did you get him? How old was he?
What was he? 8 weeks?
He was 8 weeks. He was born at Pause.
Yeah, he was born at Pause.
Okay, so 2 months. How old is he now?
Just turned a year old a month ago.
When did you see the reactivity start?
I don't know. What do you think?
And honestly, before we sent him to the board and train, it wasn't even that he was reactive to treatment.
Yeah. Yeah. He was lunging, but I would say that he was lunging, but he wasn't getting aggressive. But he was also a baby then, and he was a lot smaller. Mm-hmm. I mean, now he's 75 pounds, and.
How old was he when you went to the board and train?
That was November, so.
8 months. 7, 8 months.
Yeah, he was born in April, so 4 to 11. Yeah, about 7, 8 months.
Okay.
7 months.
So that's when you started to see the reactivity come.
Yeah, it definitely got worse.
Okay.
I mean, he would want to meet other dogs, but now he looks really aggressive.
Were you walking him in a harness at the time?
Yes.
Okay. And then you switched to this after the training, the prong collar?
No, they had him on a yank collar or whatever you call it.
Okay. Slip chain.
A slip chain, yeah. And then after that, we switched him to a harness. We had him on a gentle lead for a little while, switched back to a harness, and then recently it's just I had to get him on this because I need to be able to control him when he's in those scenarios. With the harness, he could just that little bit of extra, him being able to lunge, he got too close a couple times. So.
I got you. With the board and train, did you get any follow-ups on like how to address the behavior? Like
they did offer follow-ups, but they kind of pissed me off because he was sick while he was in there. They had sent me pictures. I saw he was sick. I told him he was sick. They told me he wasn't sick. I picked him up and I had like a $750 vet bill with infections in his eye and on his
Do you know why?
privates.
Allergies or anything? Do we know?
The vet didn't know what it was. He had some kind of, I don't know, he had white blood cells, so it was some kind of a urinary, okay, it was a UTI.
I gotcha.
So.
When we picked him up, there was no teaching us.
Yeah, they didn't go over like commands. We even asked them what the commands were, and
okay.
So they did offer the follow-ups, but I just did that.
Yeah, I understand. Was this out in the suburbs?
No, they were. What was the guy's name? His name's Jim. Chicago K9. They're on Belmont Avenue.
Okay. Oh, they're in Roscoe Village, I think.
Maybe, I don't know.
All right. Well, what most likely happened is due to stress, he probably wasn't using the bathroom the first couple of days, and he held it for so long he probably just got the UTI.
Okay.
And then they, were denying it. Obviously, obviously there was a clear issue there, so that's most likely what happened. It's happened here. We had usually when we get dogs, we tell people we expect that the first 2 to 3 days we're not going to see the dog pee, poop, eat, or drink. So I already kind of tell people. It's very uncommon that it would lead to a UTI, okay? But typically there's going to be signs. Either they're peeing blood, they're peeing infrequently, they keep trying to pee but no pee is coming out, to which we'd be like, hey guys, there's a problem.
Well, he had an eye infection too, so.
Well, that I'm not sure.
Yeah.
But the UTI for sure, I'm like, okay, we've seen it before.
Yeah.
But it's
I mean, it
uncommon.
wouldn't have been a big deal if
They just don't.
they acknowledged it, because she sent me a picture of him. I said, his eyes are bloodshot. He's never bloodshot like that. He looks sick.
Yeah.
And she said no, and then they had him for another 5 days, and I picked him up. I took him right to the vet. I'm like, what the hell, people? I told you.
Yeah.
Like, you know, if I just picked him up and he was sick, I would have been like, okay, whatever. But the fact that I, like, acknowledged it and they were like, you know.
Yeah, that's unfortunate. I'm not
Yeah.
sure why they would do that.
Yeah.
We tell people, like, if we know something, if we see something that's off, we'll tell them, like, for example, I just had a board and train. He's doing 5 weeks, but they did 3 first. They're splitting it. And he already came here with ear infections. So, but they moved from Las Vegas here, and he's a Mastiff who's reactive. So they wanted to just drop him off as long as we didn't mind treating his ears.
Yeah.
And he was fine. He let us treat it. One of them got better, and then the other one was getting better. And then this past week, I saw one of the owners on Saturday, and then 4 days after that, we noticed his right ear was getting worse. And then the next morning, I shot her an email going, hey, by the way, this and this happened. And they're like, okay, thanks for letting us know.
Yeah.
I picked up yesterday, you know?
Yeah.
And also, I don't have an issue. Obviously, if there's a medical thing, like, we can interrupt the board and train to take the dog to go to the doctor.
I know, yeah. I would have paid for the vet visit, like, you know,
So, yeah, I'm not sure. But anyways, so we're here. How did you find us?
I did
She did a lot of research.
a couple weeks ago, so I did a lot of research, sent Justin an email with notes on
She picked out about, like, her top 5 places, and
place that
I
was most highly rated.
figured you guys were good, so.
Was it ChatGPT or something?
What?
I'm sorry, was it like AI or something? Or I'm sorry, how did?
She just
Search?
went through Google searching,
see. Just
going through all the reviews,
I see, I got you.
and then she made me a little report, you know, these are my top 5, and
Oh, that's cool.
yeah.
Because now you can do that with AI, apparently.
Yeah.
I've had a couple people that are like, oh yeah, I just looked in ChatGPT and like it pulled you up. I'm like, oh, that's cool. I guess.
Yeah.
All right. Anything else I should know about your dog?
I don't know.
Sometimes
He gets a little excited in the cars. We do have him medicated on. Right now he's on. Yeah. And yeah, so he's doing it every 12 hours to try and do.
I've not heard of that one. Do you know what it's described as? Like, is it anti-anxiety? What's it?
which one?
The clonidine.
Yeah, I've not heard that one before.
It's for anxiety. It's supposed to help with their serotonin.
Okay. All right. Yeah, the most common ones I hear are trazodone, fluoxetine, gabapentin. Clonidine is a completely new one, so I'm not sure if that's a new medication that they're doing now.
Okay.
Okay. How long has he been on it for?
What, 2 weeks?
Okay, so new.
Yeah.
Okay.
No, just trying to curb this. Maybe a month. Yeah, a month.
Okay.
Just trying to curb his reactivity. Yeah.
Yeah. And you said off leash, you social?
Very.
Yeah.
Very.
Okay.
Yeah.
So this is not uncommon, where clients usually confuses them because Jesse, I don't get it. Like, the dog on the leash is super reactive, off the leash they're completely social, right? It could be for a number of reasons. One can be frustration. Okay, so he was a puppy, normal puppy, friendly. Around 6 months, puppies or dogs have developmental stages, 6 months, a year, and 2 years. Okay, so a lot of times if there's going to be like a personality shift, as I would describe it, right? It's around those periods. So you could have a perfectly social puppy, and then at 6 months, all of a sudden we start to see reactivity. Okay, or if not 6 months, at a year, we'll start to see reactivity. Okay, very uncommon that it happens at 2 years. It's almost always 6 months or a year. Okay. So what happens is a lot of times puppies are also walking their dogs on harnesses, right? Because we don't want anything putting pressure on the throat, because puppies typically don't walk well, and we get the gagging and all that stuff, right? So a lot of clients will put their puppies on harnesses. Makes sense. Dogs have a thing called opposition reflex. Are you familiar with this term?
No.
Opposition reflex means when a dog feels tension, they want to go against it. So if you pull back, he pulls forward. You pull left, he pulls right. You pull right, he pulls left. He wants to go opposite to you.
Okay.
Right? So if you put a dog on a harness, and like, let's say he's a friendly puppy, right? and they see a dog, it could be on a flat collar too, it doesn't really matter, but harnesses make it worse, is if he sees a dog and you pull him away, because maybe he hasn't had all his vaccinations yet, maybe it's just you don't want him to bother the other dog, right? Or maybe that dog's being reactive, you're pulling on him and you're applying tension. And the opposition reflex kicks in and he starts to get frustrated because he can't get to the thing he wants to get to. Does that make sense?
Yeah.
And then we do that over and over and over again. Is that what starts out as friendliness and curiosity becomes frustration because it can never get to the thing. And then frustration becomes agitation, agitation becomes aggression. Okay? This is a very common thing that I see with clients that walk their dogs on harnesses, which is why I asked before, like, oh, did you walk them on harness? Okay? So let's say it wasn't the harness, it was just a personality shift that happens, right? But then the harness exacerbates the reactivity, it makes it worse, okay? Is that in protection training, where we train dogs to be aggressive on command, right? We use harnesses, okay? It'll be the handler with the dog on a harness, and then you have the agitator, right? And they're being suspicious, they're doing things to incentivize growling, you know, of the dogs are being suspicious, or like, oh, is this a threat, right? They'll come in and be threatening and stuff like that, and then they'll run away so that we get this kind of lunging behavior from the dog. And eventually the dog gets so frustrated that they might snap, right? And when we see those lunging or snapping behaviors, because we're pulling the dog back, because we're creating frustration through restraint, right? And once we start to see lunging or snapping, we would release the tension because we want to reward that behavior. Does that make sense? Most people, you know, get stuck in just always pulling the dog away, and it's just constantly building this agitation over the course of time, and then unintentionally creating like a protection dog, so to speak. Okay, it's like the most common thing that I see. Other things that could happen, just as FYI, is you could have a perfectly normal puppy, it could be 8 months, right, past the 6 months or whatever, and then they have a negative experience with the dog, and that negative experience will shift them. Okay, so they're playing in a dog park.
Yep.
One dog pins them down.
Makes sense.
Snaps at them,
Yep.
and then like a light switch, the next day they're reactive.
Yep.
Okay, that's another thing that I see. Regardless of why it happened, it's already here. It's still the same approach in terms of addressing it. How it triggered doesn't really matter to me. It's still the same way to stop it.
Okay.
It just helps the owner understand why it's happening or give them an idea why it happened. Okay. So I'm going to assume it was most likely around just personality shift. He's a Shepherd mix.
Yeah, Shepherd American Bully.
American Bully. I want to have seen the American Bully. Shepherd for sure. So Shepherd.
That's what it said when we did the DNA
yeah.
test. I don't know.
No, I mean, if it's a DNA test, I'm not going to argue with it. I
Yeah.
just wouldn't have guessed American Bully.
Yeah, we thought Shepherd Rottweiler by looking at him.
Okay. So Shepherds, you know, they're known for being kind of protective and all that stuff. So to me, I go, it kind of makes sense that that shift would happen. And in some cases, only towards dogs. Other cases, humans. Other cases, it's both. For his reactivity, I know dogs for sure. And then you said sometimes people. Is that correct?
Yeah.
Okay.
Yeah, well, like, we have a narrow hallway. You come down from our elevators, and this is going to change soon, but it doesn't really change that it's a problem. But this exact scenario is, so it's there, you know, you can't see through the door. Open up the door, somebody's there. He's like a bat out of hell. So I got to drag him back. He's barking. He's foaming. So it's people when he's spooked, when he doesn't expect them. Elevators, people coming into the elevator. He's been better with that since I put him on the prong, and I will direct my body in front of him so he doesn't just immediately see someone coming in, and then he's a little bit better letting him in. Okay. And he has been sitting and letting him come in the elevator. But he just is going, it's like going through doors. He's on the lookout. Thresholds, yeah.
Gotcha. Yeah, so he's a little vigilant here, right? He's tense, but he's not overly tense right now. Okay. So nothing I've not seen before. This is what I do for a living. I'm assuming you saw that we use remote collar here, Alyssa, for training?
Yeah.
Yes.
And so the previous place was just slip chain, is that correct?
Yeah, just slip chain. I think they had him on prong.
On prong?
They
Okay.
had them on Prong. I don't know if they did any e-collar training. But
They didn't tell us if they did
I
e-collar
doubt it,
training.
yeah. I doubt it.
I know they do.
Do e-collar.
Yeah, but they didn't say anything about it.
And then never, like, you know, offered to, like, show us, you know, how he is on the prong. Never suggested that get a prong after the fact. They just
Yeah.
home with the choker, and that
Yeah.
was it.
That's unfortunate. I mean, it's more common than you think.
I know.
Fortunately.
I know.
Yeah, it's,
There's a million places.
but yeah, that problem So here what you'll do is you'll shorten your leash, you're gonna pull up on your prong, and you're gonna press down on his hindquarters. Yeah, like that, there you go, and then just relax, perfect. So, like this here, that looking is like nervousness. Like a more kind of stable dog would like look, but then we wouldn't get the growling. Okay? This here is just observance. I don't really see any real tension here. But that most likely is where the reactivity is coming from. It's just nervousness. Dogs aren't reactive for the sake of being reactive. Like it's
Yeah,
a
of course.
symptom
There's a
of something.
reason. Yeah.
Exactly.
Yeah.
And once we understand the reason, it helps you kind of navigate the world much better. This is okay. You see how he's laying down? Not.
He's ready.
He's ready. Exactly.
Yeah.
Yeah. Okay. Good. But this isn't too bad here because like I would expect to see reactivity like with what's going on right there. But he's just on high alert right now.
Yeah. I mean, he's not, a terrible dog. He just, it's these episodes. I mean, like we're living downtown for another year, and he needs to calm down when we're entering and exiting the building, and we're going to a place that there's a lot of dogs living in the building, so we just need him to be able to not tense up. And
so part of what we do here is, so we have in-person, we have boarding trains, we have daycare trains, okay? When we have a dog that's reactive, we can correct the behavior to help teach the dog to make better decisions, but then you have to then learn also how to live and handle a reactive dog, right? And those two things kind of go hand in hand. It doesn't matter if I'm a really good trainer, and the dog's trained really well, if the owner doesn't know what they're doing.
Yeah, of course.
Do you have a preference? Are you looking to do like a boarding train, or are you looking to do like an in-person?
I guess I don't really have a preference.
Okay.
Whatever's going to work is what I'm concerned about.
There's pros and cons, okay? In person, pro is you learn a ton because it's you training your own dog, okay? The con is that it's gonna take longer.
Yeah.
Right? But we don't have to worry about transference because you're the one doing all the training. I don't even need to handle your dog. You come up, you show it your dog, you have your leash, your dog, your training collar, your e-collar, right? I coach you through everything. I very, very, very rarely ever have to step in to help, okay? And then I give you your homework and you go and you practice what you learn, okay? You come back, you give me feedback. I'll ask you, how has his reactivity been? You're like, oh, it's 50% better. I go, great. We got 50% of it done already just for one class, right? You give me other feedback. Maybe it could be 20% better, 80% better. I don't know. You tell me, right? We do a quick little review, and then we work on the second part of the heel exercise, which is leash walking, okay? We might make some tweaks, go off, rinse and repeat. Come back. How are you doing? Oh, Jesse, even better, but we've noticed he's got difficulty in these areas, right? Maybe it's other reactive dogs. It could be getting on the elevator, tighter space makes sense, right? You'll have problem areas, and we can either have a class focused on those problem areas, or if I think I can just make a couple of tweaks, I'll tell you, when you go into these settings, this is what you're gonna do with your e-collar, and then today we're gonna cover something different. Next class, you let me know if it worked, okay? And then we just kind of play it by ear from there.
What frequency are you talking about for classes?
Once a week.
Once a week.
Once a week. Once a week for an hour. Correct.
Okay.
Generally, with most reactivity, by the third, maybe fourth class, we've got like a good handle on the reactivity where the owners feel confident, and they're like, we can get this done by ourselves or whatever, and then we work on like other stuff. If we ever need to revisit, not a problem. With the boarding train, the pro is we get things done faster, right? Chances are we're probably not going to see reactivity here. It's not that uncommon where dogs come in reactive and then they're here and they don't do a thing, okay? The board and train, con is, pro is get it done faster. Con is the training is tied to us, and then we have to transfer the training over to you.
Yeah.
Okay. One thing that I do to combat that is that for every week that we have the dog, I film the first lesson of everything that I teach. Okay. The first week is the most in-depth. It runs between 2.5 to 3.5-ish hours long. Okay. So it's your dog and me. Heel, sit, stay down, come place, all that stuff, right? The first lesson of each thing I'm teaching, right? And I'm talking to the camera, and it's your dog being trained. Let's say he's getting skittish with the e-collar, right? You see me work him through it. Let's say he's being nervous. You see me work him through it. Let's say a dog came out and he did become reactive. You see me work him through it. Everything's real time, okay? I make a comprehensive video. I send it to you. You watch to start transferring the information, okay? Because a lot of board and trains, it's you drop your dog off, you pick your dog up, what happened, right? So the videos help show people this is what's going on. If we have the dog for a longer period of time, let's say it's 2 weeks, the second week we start to advance the training, that video is usually around 45 minutes to an hour because all the learning is in week 1, okay? Our board and trains go up to 4 weeks to 5 weeks, depending on the case. The longer we have the dog, the more videos you get, 1 per week.
Okay.
They also come with follow-ups. A 1 week board and train comes with that 2 to 3-ish hour video and a 1 hour follow-up. A 2 week board and train comes with 2 videos and then 3 1-hour follow-ups. A 3 week board and train, 3 videos, 5 follow-ups, and it just kind of goes up from there. Okay. The follow-ups can be used to review things that maybe aren't transferring well from the videos, because it's one thing to watch it and then it's another thing to apply it.
Yep.
Right. Or let's say his obedience is doing great. You're being able to implement everything, no problem, but you're struggling with reactivity. No problem. Let's have a follow-up and let's focus on the reactivity, because if I don't see it here, then I can't cover it in the video. Okay. We can try to force it by like bringing a dog out and stuff, but if he's not reactive, then it's like nothing we can do. Okay. So the follow-ups aren't restricted to only covering what was covered in the board and train. It can also be covered. It can also be used to cover stuff that was not covered in the board and train. Okay. So it's just, that's why I was like, it's personal preference for your particular kind of case. Okay. Question on any of that stuff?
I don't know. What would you recommend?
Do you want to get it done faster or do you want to learn more?
I feel like because of our situation with us moving so soon and just how, like, the way he is sometimes right now, if anyone from management saw him, they'd quickly be like, either you or the dog has to go. So I personally think that.
I mean, how do you bill for the board and trains versus the?
We're paying full for the program to start.
So you bill you bill out for a whole program. I mean.
Correct. Yes. Yeah.
So
if you do a 2 week board and train, like you could reserve a future date, for example. It would be half down to get your reservation in, and then the other half is due before the start of the program.
What I'm thinking about doing is like, what about 1 week board and train, but we add on some more sessions.
Like private one-on-ones.
Yeah, that's kind of where I would lean towards going.
Okay, you can do that. There's not an issue with that. The only thing would be. Trying to think here. When is your moving date?
Yeah.
So you got like 2 weeks, 2.5-ish weeks?
Yeah, it's about 3.
I see.
3 weeks from today.
And then you will also be gone.
Who's gonna be?
Well, yeah, but we shouldn't. That's not a huge deal.
The new place, is it like a high rise? What I would do is, if you wanted to do something like that, I would probably suggest do a couple of in-persons first, and then do the board and train kind of crossing that moving stage. If that makes sense.
Okay.
And then you'll be settled in the new place, and then we begin to transfer all the stuff over, right? The reason why I say that is there is a lot of value in just doing the healing exercise on your own. You're going to leave this place anyways, right? So it's like, all right, it might be rough for the last couple of weeks at this current place, but you're going to get a lot of experience there. Once you understand how to handle reactivity, life becomes a lot easier. And then he comes, you guys can focus on moving. You already got good experience on working with reactivity and stuff like that. And then I just do more obedience with him and more control. And then you pick. Does that make sense?
Yeah.
I think that would be the better approach there.
Because I mean, I think he needs some dedication, like from a trainer in a situation like this, but I know that like I want to be a big part of it too, obviously.
Yeah, I think that would be good. So
Okay.
yeah, it'll just be rough the first week or two as we're kind of getting things under control.
Yeah.
But if you're leaving the place already, it's kind of like, all right, cool. It's just, well, who cares?
Yeah.
Just
Yeah.
take the time to practice.
Uh-huh.
And what we could do is for the first class, you can extend it by half an hour.
Uh-huh.
It's like I think it's $100 for an extra half an hour. I'm going to show you how to do the healing exercise, but then we can spend that last kind of 30 minutes of me showing you how to handle reactivity.
Okay.
Okay. So after that first class, you should be leaving with a good
Framework.
yes
Yeah.
to just get by. Okay. And then the rest, we should be fine.
Okay.
Okay. Are you familiar with how e-collar works at all?
I mean, no.
The technology? What about you, Alyssa?
Well, I know.
Do it a bit more.
What's your understanding of it?
I mean, essentially, like, from everything that I've seen, as far as like teaching them on it, it's more so like it's not as obviously a punishment tool. It's more so as they're using it to learn. Like you do their commands that they know, and then when you vibrate them or whatever, it's them associating like, okay, that command when I feel that, I perform it. If that makes sense, I don't know if that made any sense.
No, you're good. Do you know what the technology is? Like what it is, like what the dog is feeling?
No, I mean I've read about like the difference between like the vibration methods versus the shocking, but not like the advanced technology of it.
Okay. Have you guys ever been to a chiropractor or physical therapist?
Yeah.
Have you had the TENS therapy? The machine that moves your muscles?
Yep.
That's an e-collar.
Okay.
Okay. So just to
Yeah, I did that a lot.
yeah, clients usually think like it's like a shock or
Like they put like a sticker here, sticker here, and it. Yeah. Yep.
That's exactly what an e-collar is.
Okay.
Okay. So it's not electricity running through your dog's body or anything like that. It's a centralized current that just contracts the muscles where it's making
Yep.
contact.
Yep.
So if you were to put it on your hand and press the button, it would feel very similar to what you felt at the physical therapist's office.
Yeah.
Okay? So, yes, it's taught as a communication tool, but it can also be used as a correctional tool, right? So punishment doesn't necessarily mean like bad. Punishment just means like if you do something wrong, there will be like a bad consequence, right? And that consequence can be subtle or that consequence can be severe. Every dog is different.
Yeah.
Okay. I'm sure you've positive reinforcement, right?
Yep.
Positive reinforcement is great for stuff you want to see again. It is not good for deterring behaviors.
Yep.
Okay. That's why we have punishers. That's why we have correctional tools. Your prong collar, technically speaking, is a punisher.
Yeah.
Okay. Now, do you know why your prong collar looks that way?
No.
Because it's meant to mimic a dog bite.
Okay.
Those are teeth.
Okay.
Right. So people see a prong collar, they usually think like, oh, it's stabbing the dog, right? Because humans always perceive things negatively. But once you understand, like, no, like that looks like that because it's meant to mimic a dog bite, right? So if he became reactive, technically speaking, you could use your leash to do a quick pop to create a snapping motion, which is meant to mimic a dog bite, because that's what another dog would do, right?
Yep.
So if he was at the park and a dog mounted him and he snapped at that dog, he's not being aggressive. He's setting a boundary, right? Same thing here. So I like to think of the e-collar as a bite on a button. I can press the button and it'll contract the muscle, and if conditioned correctly, the dog will perceive it similar to a dog bite. So now I have means of active, direct, instantaneous communication, even if the dog's in an arousal state or a reactivity state. Okay, it just depends on what number would he need, and it's fine if he goes up there. Would he need to to deter the behavior? Now that I don't know. Okay. Now, can you still hear me, Alyssa?
Yes.
Okay. So we figure all that out through the training, right? For reactivity, his number, typically behavior numbers are higher than obedience numbers. Our collar goes 0 to 127 in increments.
Okay.
Okay, 0, 1, 2, 3, 4, 5, 6, all the way to 127. So his obedience number, let's say for example, it's 25, and he's doing great. But when he's in reactivity mode, 25 might go out the window, and maybe we're at 65.
Yep.
Okay. I don't know what it's going to be. We figure all that stuff out through the training. His reactivity number outside could be lower than his reactivity number in the elevator. Makes sense, right?
Yeah.
Because we're in tight space.
And I'm sure it would be.
Yes.
Yeah.
So a lot of it is common sense. And
Yeah.
once you understand how to read him and how he's perceiving the collar, you just go up and down on the settings. Like you don't even think about it. Okay. It becomes very intuitive.
Yep.
It doesn't matter the size of the person. You know, like I've had couples where like the husband was like 6 foot tall and then the wife was like 4'10" or something, and they had this 120-pound
Hey, bud.
German Shepherd.
Come
Did
on.
it matter?
Come on.
Because if she pressed the button at 60 and the husband pressed the button at 60, it was the same across the board.
Yeah.
Right? Whereas with the prong collar, not uncommon where I
Yep,
get like,
it's-
oh, my husband can handle the dog,
But I
me,
can't, yeah.
I can't, exactly.
Yeah.
All of that stuff isn't a
Like
problem.
where we're at now, I wouldn't let her walk him. I mean, if we're, you know, like at her parents' house in the suburbs or something like that, he's okay. But in the city, she wouldn't be able to walk him
I
around.
got
Yeah.
you. Yeah.
It just wouldn't be safe.
Yeah. So the e-collar helps compensate for a lot. Okay.
Yeah.
Now, the one thing that does hold people back is their comfort with applying higher level corrections. Okay. Again, I don't know what his number is going to be, but let's say we're working through things and I go, oh, you have to go to 85, right? And then you come back the following week and I'm like, how's it going? Like, oh, it was really rough. The first thing I'm going to ask you is what level was your e-collar at? Okay. And if you're like, oh, we're at 35, I'm like, what happened to 85? Well, you know, we felt kind of bad. He yelped or something. I go, right, but that's why you're not going to stop the reactivity. Okay. Now, my theory of training is as low as possible, but as high as needed.
Yeah,
Okay?
of course.
Ideally, we don't want the dog vocalizing. I was raised old school. I was spanked. I did not walk away with a spanking with a smile on my face, right? We start low, we work our way up, and sometimes it happens where the number that's going to stop the reactivity is the same number that's going to make the dog yelp, right? Because it's a firm consequence. But that's how we stop the reactivity, right? Again, I don't know, but we just like with the physical therapy stuff, I'm sure they started low and then they were
Of course.
gradually going
Yep,
up.
of course, yeah.
It's the same thing for dogs.
Yeah.
We start low, we work our way up. He tells us what's too much and what's too little, and we simply adjust accordingly. Okay, it's very common sense once you figure it out.
Yep.
Questions on any of that?
Nope. You good?
I did want to ask because we were holding off on, we wanted to get him, I forget the brand of the like original prong collars. We were going to get him one, but then when I read about your training, I knew that you would have us get one anyways. But was going to ask, even if it's at the end, if we could get like the specifics of which one you use as well.
For the prong?
Yeah.
Yeah, that's not a problem.
Yeah.
Yeah, so this prong is fine for now.
Okay.
I'm not a fan of anything that's altered. So like yours has the collar around it and it has the kind of nylon strap there. It inhibits the motion.
I could see that sometimes.
Yeah.
I mean, you tell me what, just tell us what
It's
you
a
got.
Hermspringer. He'd probably be a 3mm. I don't care where you get her from. But
Yeah,
if you go
yeah.
on Amazon, Hermspringer 3mm,
Okay.
unaltered, no alligator clip.
I wanted to make sure.
Yeah. No alligator clip either. You don't want that because those can unsnap.
Okay.
And then you have a free dog, which you don't want right
Okay.
now. Okay. The e-collar, I put them on as the Dogs Are Black edition. We carry them here. You do get 10% off anything that you buy from us as a client. I don't care if you get where you get it from. I do care that you get the correct model.
Yeah,
Okay.
yeah.
And then Tina will send us information as well. Okay, Alyssa?
Okay.
It's the highest power collar. It's meant for a 70-pound dog and over. He looks like he's around 60, 70.
75
75.
was and that was like 2 months ago was the last time I weighed him. So
So it's the collar that's appropriate for him anyways.
Uh-huh.
Very good. Even if he was a smaller dog, you just get more from less. It's just more output. That's all it means.
Yep.
Okay. One of the common questions that I get is when does the e-collar go away? In my book, when you need it, it doesn't. Okay. When you're walking from the front door outside, you have it on. Obviously, when you go outside for a walk, you have it on. If he's going to be off leash, you have it on. If you're going to take him to a restaurant, you have it on. If he's a great dog inside the house, you have it off. Okay. It has nothing to do with my skills as a trainer. It's what's known as opportunistic behavior. You guys familiar with this?
no.
No? Do you guys drive?
Yeah.
Do you go on the expressway?
Yeah.
Do you go speed limit?
No.
You see a squad car, what happens?
You slow down.
You pass the squad car, what happens?
You look in your rearview mirror.
And then when they're gone,
You speed back up.
speed back up. That's
Yeah.
opportunistic behavior.
Yeah.
Okay? All animals do it.
Makes
Okay?
sense,
It's part
yeah.
of survival instinct. So for him, when that collar is on, the
He
cop
knows.
is present.
Yep.
Yes.
Yeah, he
Okay?
knows.
So you shouldn't be using the button all the time. Okay? It's simply present in case something happens, right?
Yep.
You could be at the park minding your business, you got an off-leash dog charging you. Okay? Let's say he's off-leash, he's playing, somebody blows up a firework at the park, he runs away because he's scared, right? It's like those emergency
Yep.
situations. Every now and then in the blue moon, like with my dogs, they've been off-leash trained for 15 years now, they're 16 years old. If I know they're gonna be off-leash, like at a public park, their collars are on still, okay? But I can't tell you the last time I pressed the button.
Yeah.
Okay, it's just there in case something happens.
Yep.
If I find a client that is still regularly using their collar, and it's not like a extreme case, that tells me they're too low on the remote. Okay, because if you have it at the correct setting that the dog respects, the dog goes, I don't want that to happen again,
Yep.
so I'm just going to be obedient and behave myself.
Okay.
Okay, does that make sense?
Yep.
But yeah, it's the most common question that I get. As long I can only take, also the other one is I can only take as far as you're willing to go. Tying back to earlier, like if his reactivity number ends up being really, really high, if you're not willing to correct them at that number, you're gonna stay stuck where you're at.
Of course.
Okay.
Yeah. I'm
It
not
all
worried.
comes down to I'm a really good trainer. I've been doing 16 years. There's nothing that I can't handle, but what always holds me back is the owner. Okay. Because they let emotions come into play and stuff like that, and I go, dogs don't think.
We're not worried about it. We know he's not safe the way he is now,
Sure.
so
I gotcha.
it's not safe for us or him.
How is
so.
he at the veterinarian?
Pretty good.
Okay.
I mean,
So it's really just walking out and all that.
yeah. I mean, like when the dog's walking by, he does get a little excited, but he's definitely better there than he is walking in and out of the building.
Okay. It kind of sounds like he's become territorial of the whole building in a way.
Well, also the setup of it is just difficult too, because like with how we currently are, he can't go through the lobby. He has to go through the back door, and so he knows that back door is that walk in and out. That's all the dogs have to go.
But it's going to be the same place at the it's going to be the same thing at the next place because there's only one way in, one out.
And if needed, by the way, once you guys moved, right, is you can do you're gonna still be in the city.
Yeah.
You can do an in-home. It's $50 upcharge.
Okay.
For me to go to you, and I can show you how to navigate and give you my
We'll definitely do one of those. Yeah.
Okay. Trying to think here. Any other questions?
When do we start?
So if you want to do like the couple of in-person, like I'm recommending,
Yeah.
it's all based upon your availability.
Okay.
Okay. So the board and train you can book out, not a problem. You can reserve your spot, not a problem. We have space. So what you can do is when you leave here, you can message Tina and go, hey Tina, sign us up. This is what we want. Okay. You can, if you're gonna do, is he gonna need daycare or boarding in the future?
Like most likely not, but possible.
Okay.
Her parents take them, and my parents take them if they can't.
Okay.
So for the most part, he's good. Why do you ask?
Because it just helps with my recommendation. So
I mean, there might be time like you guys to keep up with training, or what do you mean by that?
So like dogs that have trained with us, if they've met the minimum requirement, can board whenever. Okay. If we've not trained a dog or if they've not met a requirement, they have to come to daycare once a week in order to use our boarding services. Right?
Okay.
So what I would suggest is you can do 3 in person as a separate program, 3 1 hours, and then a 2-week board and train. And then you get another 3 hours of one-on-one with me for a total of 6.
Okay.
With the 2-week, we do the foundation, which is the long video. And then the second week, I start to build them already towards off-leash obedience.
Okay.
And then the rest, I can help you get to fully off-leash. And then with the 2-week, he'd meet our minimum 2 in terms of if you needed the board. Trust me, it happens where clients like, oh, I don't think I'll ever need it. And then one day, like, oh crap, like the people who would watch them are all out of town.
Yeah.
Whatever.
No, it could happen. Yeah,
Yeah,
it
and
could
then
happen.
you get a nice, healthy amount of one-on-ones as well.
Yeah.
To make sure that we transfer all the obedience. And if for whatever reason, if we're having difficulty with the reactivity, we have plenty of classes to get it done.
Okay.
So yeah, I would do a 3-week in person for 3 classes, and then a 2-week board and train, which gives you another 3 follow-ups. Okay? And then book the first, if you can get 2 in before you move or before his board and train starts, that would be great. And then he comes here, I do all what I need to do. If you want to do another follow-up on the pickup, you can. You just schedule that through Tina, okay? Or if you feel like what we covered before the board and train, plus what you learned from the videos is enough, you're welcome to pick them up, give it a week or 2 of just seeing how it goes, and then coming back for a follow-up, or me coming over for a follow-up to help kind of bridge the gap on anything that might be a problem.
Okay.
Okay? Does that make sense?
Yep.
So yeah, you tell Tina, hey Tina, sign us up. We want a 3-week in person. We want a 2-week board and train. These are the dates that we want. And then she'll put that on our calendar. She'll send you a link to create what's called a Ginger profile. That's our daycare software. Okay. Our training contract is also in the software. So once you sign them up for the boarding profile, whatever, it comes with that training contract as well. Okay. So that's all in our system there. Okay.
Okay.
Questions?
Do you think he needs the 2 weeks?
Do I think he needs it?
Yeah.
I mean, I don't know in the sense of the reactivity.
Yeah.
The 2 week boarding train gives you an extra 2 classes that the 1 week wouldn't.
Okay.
So that's kind of why I'm suggesting that. Because then with 6, I feel pretty confident that we're gonna get that
It'll
done.
be done.
Yeah. So then the rest is like,
Yeah. Yep.
because the other thing too is that we don't prorate programs. So if you did a 1 week board and train and then wanted to add another, it would be $1,750 plus $1,750. If you commit to a 2 week up front, it's $2,750. So it's $1,000 or $750 cheaper, whatever.
Yeah.
it is.
I get it.
Yeah. So it's more cheaper up front as well.
Yeah.
Okay?
No, I'm not super worried about the money. We just want to make sure you're the last guy we ever deal with this.
Yes. I've had
And I do feel
clients
comfortable with
spend
it.
like 10 grand on like 5 different trainers and like make dick for progress.
Yeah, we're at about
Yeah.
we're
That's
yeah.
unfortunate.
Well, after this we'll be at about 10 grand, but
Yeah. We'll get it done.
yeah.
As long as you follow the instructions, we'll get it done.
Mm-hmm.
Okay. Very, very rare. Like I can usually tell during the consult that I get to these like very severe cases, right? And even those cases make a ton of progress.
Yeah.
You know,
Yeah.
we got dogs that come from St. Charles, Winnetka, Skokie, Indiana, Wisconsin, Lombard, because they can only come here. Which is why we have that. If they've trained with us and they met a minimum, they can board here whenever. Because I don't expect the person from St. Charles to come once a week for daycare to board their dog. They probably would, but I'm not going to do that to them.
Yeah.
You know, but yeah. So then also you'll be covered if he needed to board.
Yeah.
In the future, just let us know ahead of time so we know you can tell you the steps.
Yeah.
Because we need vaccination records and a fresh fecal and all that
Yeah,
stuff.
of course.
Okay, but that's not a problem. And what's nice is that we do follow. We reinforce your training, right? So I know there's been some barking here. There was a little bit of a roar in the beginning. That's my neighbor's kennel. Okay, so if you heard like a lot of
Oh, I heard a bunch across the street.
yeah, so that's their kennel. You know the canines that you see on the CTA train? You ever seen them? The guys
Okay.
walking around? Those are my neighbor's dogs.
Oh, okay.
And all those dogs are boarded in the back of our building.
Okay.
right?
The
So-
police dogs?
Yes. Well,
Okay.
they're canines. They're security dogs. They're not police dogs.
Okay.
He actually just lost his contract. It sucks. It's like
Really?
It was like a $90 million contract.
Wow.
Yes. So, because they're only security.
Yep.
They can only detain people for so long, and they have to wait for the police. And a lot of times, police wouldn't show up because they're busy doing other stuff.
Uh-huh.
Now the person they detained now gets to go free, but then also there's like legality issues because if they detain them for too long, or if they
Oh, I know. It's a bunch of crap. Yeah. They can't.
yeah.
Yeah.
So
They handcuff these guys, no pun intended.
exactly.
You know.
So it makes more sense that it would be cops that would be security on
Yeah.
the train, anyways.
Mm-hmm.
Anything else?
I'm pretty good. Are you good, babe?
Yeah.
Perfect. So then, if you email Tina and let her know, like, hey, sign us up. This is what we want. And then for your in-persons, send her both of your availability.
So,
if possible.
how are your programs set up for the? Like, am I paying for the before visits? For the 1 hour visits?
Yeah. So it's a 3-class program.
So it's a 3-class program. So that's
Correct.
what I'm going to tell her. Three class program plus 2 week.
Board and train.
Board and train,
And I
okay.
send her an email too with my recommendations.
okay.
So she has everything.
Okay.
So the 3-week in person is the 1 hour
Yep,
classes we
yep.
have. Okay. Send her your availability to meet with me.
Okay.
And it's best if both people are there at the same time. And she's going to cross-reference your calendar with my calendar, and then she can figure out where it's best to put you guys.
You mean with her and me?
Yes.
Another question.
Yeah.
Because with the 3, if it's once a week, I think
I would have to do one by myself.
That's fine.
That's why I'm not there.
That's fine.
Okay. Yeah, he said that's fine. Well, he wants to do 2 before, right? You want to do
Ideally,
2.
yeah.
So I can do one without you and one with you.
Well, I won't be there for either before we move.
Oh, are
Well-
you out of town right now?
Well, we could squeeze something in before Saturday.
Yeah.
I mean, I personally think it would make the most sense to just
Okay.
Go when you come here.
She graduates, so he wants,
So it's best if both can be there.
okay, here's our schedule.
Okay.
So you understand what's going on, what we're,
Sure.
she graduates May 14th.
Okay.
I fly out May 14th, which is
Thursday.
a week from this Thursday.
Okay.
And then we're driving back Sunday, Monday, possibly Tuesday.
Okay.
And then that Saturday is the 23rd, when we're moving.
I gotcha.
So she's thinking that maybe we should start it on the 14th, but I don't know if then we'd be
Oh, I see what you're saying. Yeah.
jamming it in or not.
I gotcha. So I do film the lessons, right? So if only one person can be here, it's not a big deal. It's just best if both people are here
Okay,
because you'll get the video. So if she's not here, she still gets to see what happened.
okay,
Okay. But when both people are here, it just gives both people the opportunity for hands-on experience.
yeah.
Is really
Yeah,
all.
yeah, yeah.
Okay.
All right, well, we'll look at the schedule, Alyssa. I don't think we should just try and slam it.
No, that's not what I'm suggesting, babe. I'm just saying that I think I would feel the most comfortable if, even if it's not when you come here, I think I would feel the most comfortable if he was in his board and train while we are moving.
Sure.
Because I think
That's what we're
Yeah.
gonna do, yeah.
I think planning for the 14th to start is a good.
You think
timeline.
that's
I
a
know-
good timeline?
I know it only gives us 10 days or whatever. We'll do what we can. Even if we get one class in and you get a few days of just practicing things and getting a feel for it,
Yeah.
it's better than nothing.
Okay,
Okay. Yeah, I think that's fine.
okay,
Okay. And then you guys don't have to worry,
okay,
stress about all the other stuff.
okay.
Yeah, trust me, I've been in a situation like this before.
Yeah, yeah, yeah.
So, anything else?
You good?
Yeah.
Perfect. So I'll email Tina, and yeah, if you want to get the ball rolling, just as soon as you leave here, say, hey, sign us up, and then let her know, we need to get in as quickly as possible because we only have up until this date of availability. But if you send her your availability up front, it's just easy because then she knows, okay, cool, I can just start cross-referencing right now.
Okay.
And then see where she can place you. Okay?
Okay, sounds good.
Awesome. Anything else, guys?
I'm good.
That's it. Thank you very much.
You're very welcome, Melissa. It was a pleasure talking to you, and then we'll be in touch, okay?
Sounds good. Thank you.
You're welcome.
All right, bye.
Bye.
All right, thank you.
And the mic you can place on the chair there. I'll email Tina.